So hi everybody, this is Dr. Uzi Chin, and we here have a demonstration of how to locate the bladder points on the lower leg, or I would say the leg in general. We have two sections that we're going to be covering. The first one is going to be from the gluteal fold down to the area behind the knee, or the popliteal fossa. And then we're going to continue with the lower leg, and we're going to take a break at bladder 60, which is right there at the level of the ankle. We're going to have the person rotate on the side so we can demonstrate finding the other points on the side of the leg, which the bladder channel ends up here. Okay, so we're going to have a live person. I think it's always important, other than just talking definitions. So I'm going to take you through bladder 36 first. So with bladder 36, there's a couple of ways we can consider that. First of all, we want to identify, and this is why I exposed the, you can say the buttocks, the right buttocks here, because we want to be able to demonstrate where the gluteal fold is, which is around here, okay? You gotta also know where you are on the map as far as anatomically. I usually take 3 fingers and I'm going to find the what we call the ischial tuberosity. That means where is the sits bone, okay? And I want to be able to tell, oh, it's right there. It's literally a bone. It's not like a hard muscle. It's literally a bone. You can really feel. So my third or my middle finger right now is up against the sits bone. This is important because the hamstrings are going to be having 2 lines that are going to merge and actually connect with one common tendon to that area. So that gives us a lot of information about what's going on in the back of the leg. Okay, for our purposes, you know, according to the textbook definition, we want to be able to find the medial border, if you will. Okay, I'm just showing you for the purpose of the video, but I would never just put my hands there. Okay, but I do want to emphasize that medial aspect of the leg, and then the lateral aspect of the leg. Now you're going to be able to like have the point on the gluteal fold. That's where you're going to be finding textbook bladder 36. With that said, I find it also very clinical to sometimes migrate a little bit closer, if that's the bone, the sits bone right there, a little bit more over the actual tendon of the hamstrings, which is just about half a tune difference on a person here. Then that's going to be more, I think, clinically meaningful. Okay, so bladder 36 textbook, medial aspect of the thigh, we know where the gluteal fold is right there, the lateral aspect of the leg, and then halfway point right there on that area of the gluteal fold. That's going to be bladder 36. Okay, now to find bladder 37, we want to know where bladder 40 is, because that's going to have to be on the same line. So when we talk about bladder 40, we talk about the popliteal fossa, or the crease of the back of the knee crease. We're having 2 tendons. The hamstrings are going to go and define tendon right there on the lateral aspect, as well as the medial hamstring is going to go down and define that area here on the medial aspect of the crease. Let's move the leg just for a moment. You don't have to help me. You can totally relax. But we can see, if you were to hold the leg up in the air like so for a moment, go ahead and hold. Yes. Then we see much more clearly the definition. That's the biceps femoris tendon right there. And the semitendinosus and the semimembranosus, which between them we're going to find kidney 10, but that's another story, okay, are right there. It's really palpable. You can really feel them as strings. So we know right there and here, this is our go-to lines. So relax the leg. The actual crease would be around here. Notice that it's not usually parallel. There's a little bit more of an incline to that. And then the definition of bladder 40 is right there between the 2 tendons. So we're going to go halfway, which is sort of like right there. That's between the medial aspect of the of the medial hamstring, and I would say, or lateral to that, and medial to the biceps femoris. So right there, halfway, right there at the center of the popliteal fossa. That's our bladder 40. Now, if we kept the bladder 36 all the way here, that's the tsune measurement is exactly 14 tsune between the gluteal fold and the popliteal fossa. So that makes that exact half point being 7. Bladder 37 is defined as 8 above. So 6 below, 8 above, still 14. And we want to be exactly between the 2 tendons, between the 2 muscles. So I'm feeling, oh, there's a muscle on my outer side, and there's a muscle on the inner side. So right there, we're literally above the tibial nerve, and that makes bladder 37 very good point for affecting sciatica, affecting that area of the muscles, including of course lower back. So bladder 37, this is, we find it from bladder 36 to bladder 40. We go one more above the halfway point. Right there, it's going to be bladder 37 between the two tendons of the hamstrings. Good. So we have that. Let's go into bladder 38, right? So bladder 40 is right here. If we go more lateral on the same crease and medial to the biceps femoris tendon, so again, if you can hold the leg a little bit in the air, just about so, that divot that I'm in here is actually bladder 39, okay? And bladder 38 would be one zone above it, medial to the hamstring. So you can see the tendon is right there. That's bladder 38, and that's going to be bladder 39, okay? You can relax right there. Pretty simple. The definition of bladder 38 is just one zone proximal or superior to bladder 39. Because of the tendon, it's going to be also a little bit more medial, if you will, right there. So we talked about 36, 37, 38, 39, and 40, okay? Let's take a small pause for a moment.